This former British nurse now resides in a high-security psychiatric hospital. Her crimes were of the most shocking and disturbing kind imaginable, and her sentencing judge stated that she was unlikely ever to be considered safe enough to be released. Over a period of just 59 days in 1991, she attacked patients 36 times. Her actions left the UK shocked and led to changes to the UK's National Health Service. Hi, I'm Peter. I used to be a doctor. I researched this nurse's history and also used my knowledge and experience to give you facts and insights into the medical profession that you won't find anywhere else. This is the true story of a nurse whose psychiatric problems weren't identified until it was too late. Beverley was born and raised in Lincolnshire, in the village of Corby Glen. Growing up, the villagers knew her as someone who loved babies and small children. Given the opportunity, she took delight in hugging babies and volunteered for every babysitting job available. She was well behaved at home and at school, and was her teacher's favourite pupil. But as she progressed through her teenage years, unusual behaviour began to be noticed. She continually complained of various ailments and injuries, such as stomachache, cuts and bruises, with a story like she had been knocked off her bike or gashed her arm. As the injuries and stories continued, various people began to suspect that she was making this all up. As one student who went to school with her noted, she would never show what was under the bandage and got accused of inventing injuries. When she began training as a nurse at Grantham College, the same behaviour was on display, but had intensified. She regularly presented to the hospital emergency department with serious symptoms, such as severe abdominal pain and unexplained fainting, accidental injuries such as shards of glass in her foot or burns from the stove. She was admitted to hospital several times, but her wounds regularly failed to heal because it was suspected that she was tampering with the wound or dressing. She missed as much as 40 to 50% of her nursing training and almost failed to receive her nursing qualification. Almost immediately after graduating in January 1991, she was hired by Grantham and Kesteven Hospital and began work in the pediatric ward. Then, beginning on 21st of February, strange things began to happen to the children. 13 children who were normally healthy suffered serious cardiac episodes, respiratory episodes, and unexplained unresponsiveness. 7 of the children survived and made full recoveries. 2 children suffered permanent severe disability, and 4 children died. At autopsy, 2 of the children were found to have very high insulin levels, and the other 2 had very high blood potassium levels. The hospital staff also noted 6 vials of insulin from the medication room were unaccounted for, and 10 empty vials of insulin were found in the bin in the medication room. The empty vials were still wrapped in the bubble wrap that they were shipped in. The bubble wrap had the lot number printed on it, which allowed it to be easily tracked. Further investigation found that a particular nurse had signed for the delivery of the discarded vials of insulin only 10 days earlier. And this same nurse had also been the only nurse working on the nights when all the incidents occurred. The police were notified and Beverley was arrested. During interrogation, when she was shown the empty insulin vials and bubble wrap, she theatrically fainted and had to be admitted to hospital under police guard. She was later charged and reprimanded to Her Majesty's Prison Risley while she awaited trial. During this time, her self-harm greatly increased. Some of her actions were cut herself with broken glass, swallowed bleach and shards of glass, inserted needles and safety pins under her skin and into her eyes, refused food and fluids until she almost passed away, then demanded tube feeding. These repeated actions necessitated transfer to Rampton High Security Psychiatric Hospital. Her 3.5-month trial began on the 15th of February 1993 at Nottingham Crown Court. Beverley presented in a wheelchair, heavily bandaged and flanked by psychiatric nurses. She was charged with 4 counts of murder, 3 counts of attempted murder, and 6 counts of grievous bodily harm with intent. During the trial, the horrific facts of the crimes were presented to the jury. There were 7 children who were attacked, most of them unnamed. They suffered either no lasting effects or minimal lasting effects. Some were given large doses of insulin and others large doses of potassium chloride. They had the best outcomes because they were transferred to other hospitals after the initial attacks. The other children and babies weren't so lucky. 7-week-old Liam Taylor was admitted for a mild chest infection. At the time, he was the only child of Chris and Joanne Taylor, who eagerly awaited his birth by both attending antenatal classes and decorating a nursery in baby blue and teddy bear motifs. His family described him as a happy, chubby baby who was full of energy and curiosity. They gave him the nickname Pudding Pants due to his cute rolls of baby fat. Around 9:30 p.m, the parents were persuaded by Beverley to go home and get some sleep. She promised she would keep a special eye on Liam. Within an hour of the parents leaving, Beverley injected a massive dose of potassium chloride into his intravenous cannula, which stopped his heart. Beverley raised the alarm and began bag and mask ventilation and chest compressions. The on-call doctor soon arrived and managed to restart his heart. Beverley stayed with Liam and comforted his parents who had been called back in, and told them how hard she had fought to save him. Liam stabilised the next day, and by late afternoon he was breathing on his own again. His parents were again encouraged by Beverley to rest. She told them that she would look after him like he was her own. So they went to the parents' room to try to get some sleep. Late that night, she administered a second injection of potassium chloride that resulted in a second cardiac arrest. But this time, Liam couldn't be saved. The parents who had been summoned from the parents' room by the staff could do nothing but watch as their 7-week-old baby boy was pronounced dead. Beverley attended the funeral a week later in her nurse's uniform and cried with the family. "11-year-old Timothy Hardwick was admitted after a seizure at school. He was the only child of Bob and Karen Hardwick. He'd continually shown strength and resilience, living with his cerebral palsy, which affected his movements and cognitive development. He was non-verbal but communicated through smiles, gestures and sounds. His parents had adapted their home with ramps and specialised equipment to ensure his comfort and independence. His father worked long hours as a lorry driver, but was known for adjusting his shifts to attend Timothy's school events or medical appointments. Around 11:45 p.m. on the day of his admission, Beverley injected a massive dose of potassium chloride into his intravenous cannula. She also muted the sound on his cardiac monitor so that no alarm would be heard, and then waited until Timothy's heart had stopped. She then called cardiac arrest and summoned help. Beverley led the resuscitation herself and performed CPR. 7 minutes later, the on-call doctor arrived. But despite repeated shocks with the defibrillator, Timothy couldn't be saved. Beverley sent a sympathy card to the family and offered her condolences. 15-month-old Kaylee Desmond was the only child of Sharon and Alan Desmond. She was admitted with a simple chest infection. Those who knew the family described her as the centre of the family's world. She loved music and would dance to any song on the radio. She was also described as a daddy's girl, as she followed her father everywhere. The last memory her parents have of her prior to the attack was sitting up in bed eating jelly and ice cream, waving bye-bye to the nurses as they went home at the end of their shift. As the parents were leaving that night, Beverley reassured them that she would keep a close eye on her. Within minutes of the parents leaving the hospital grounds, Beverley took Kaylee into the treatment room alone. She injected a large amount of air directly into Kaylee's intravenous cannula, which travelled to the right side of Kaylee's heart and lungs, creating a massive air embolism, which effectively stopped her heart from pumping blood. Kaylee turned blue, stopped breathing, and went into cardiac arrest. Beverley carried the limp child back to her cot and raised the alarm, shouting, "She's not breathing." She began bag and mask ventilation as the ward staff waited for the doctor on call. A chest x-ray taken during resuscitation showed huge amounts of free air in the right ventricle and pulmonary artery. The doctor managed to restart her heart, but the sustained hypoxia resulted in devastating brain damage. Kaylee's parents turned their downstairs living room into a bedroom and nursing station. They cared for her at home for 8 years, refusing residential placement because they said she was still our little girl. Kaylee passed away at the age of 9 from a massive seizure while in her mother's arms, as paramedics fought to save her. Becky and Katie Phillips were the first children of Sue and Peter Phillips. They were 2-month-old identical twins who were born 6 weeks early and weighed just 3 pounds 2 ounces at birth. They were both admitted to neonatal intensive care for 3 weeks after being born and had been progressing well. Becky was a chubby, alert infant with blue eyes and a gentle temperament. She loved being swaddled in soft blankets and holding her mother's finger during feeds. Katie was described as the feisty one. She was more vocal and always the first to cry for a feed, and loved kicking her legs and splashing while being bathed. Becky was admitted to hospital for mild gastroenteritis. Her mum stayed by her cot all day, feeding her tiny sips of electrolyte solution. Beverley, who took over the night shift, reassured the exhausted parents, "She's doing fine, go home and rest." Not long after the parents left, Beverley gave Becky a huge dose of insulin, which made her unresponsive. Beverley then raised the alarm and began resuscitation. Despite the efforts of the on-call doctor, Becky could not be saved. Becky's parents were called into the hospital. Her mum held her daughter's body and apologised to her for leaving. Beverley cried with the parents and offered to help arrange the funeral. Beverley attended Becky's funeral in a nurse's uniform and wept with the family. She also sent sympathy cards and repeatedly phoned the Phillips home offering support. Becky's parents were so touched by Beverley's shows of compassion that they asked her to be the godmother of Becky's twin sister Katie, an offer which Beverley happily accepted. Doctors at the hospital were alarmed by Becky's sudden death and requested that her twin sister Katie be admitted for observation. The first attack happened after Beverley persuaded her mother to go home and get some sleep. She kissed Katie goodbye and left. Beverley gave Katie a massive dose of insulin and a large dose of air into her intravenous cannula and also put a lot of pressure on her chest. Katie's mum had only walked 30 metres from the room when she heard Beverley raise the alarm that Katie had gone into cardiac arrest. The on-call doctor found a large amount of air in the right side of Katie's heart, as well as 5 broken ribs, but they were able to save her. The next day, a similar scenario played out. Beverley persuaded her mum to go home and rest. Just after she left the room, Beverley injected a large dose of insulin and put pressure on Katie's chest, which caused unresponsiveness and collapsed both lungs. However, she was again saved by the on-call doctor. The next night, when her mum was at home, Katie suffered a third large insulin injection, which again left her unresponsive. She was revived, but this time she was transferred to Queen's Medical Centre. The profound hypoxia that she repeatedly suffered resulted in devastating brain damage. On the 23rd of April, 1991, Beverley committed her final attack. Claire Peck was a 15-month-old toddler. She was the only child of David and Marie Peck. Claire was inquisitive and starting to say a few words. She was described by her parents as into everything, cheeky grin, and loved being chased around the house. She loved her teddy called Bunny, helping her mum hang washing on the line. The day before her admission, Claire had a mild asthma-like wheeze. Her GP sent her to the hospital for nebulizers and observation. At 8:45 p.m, Beverley told her parents, "She's fine, go home and get some sleep. I'll ring if there's any change." At approximately 1:15 a.m, Beverley took Claire into the treatment room and injected a massive dose of insulin. Claire was unresponsive and grey in her cot at 1:30 a.m. when Beverley raised the alarm and began resuscitation. The on-call doctor arrived minutes later, but Claire couldn't be saved. She was pronounced dead at 1:55 a.m. Claire's parents were awoken by a phone call at 2 a.m. and arrived at the hospital to be told that their daughter had just stopped breathing. They held her still warm body and was sent home in shock. Claire's funeral was held a week later. Beverley sent flowers and a sympathy card. Psychiatrists gave evidence at the trial that Beverley suffered from 2 major psychiatric illnesses, Munchausen syndrome and Munchausen by proxy syndrome. Munchausen syndrome is when a person fakes or creates injuries to themselves with accompanying false stories in order to get sympathy and attention. Munchausen by proxy is when a person injures another person, usually a child, and creates false stories about what happened in order to get attention, praise and sympathy. The psychiatrist stated that Beverley craved being in the spotlight as the hero nurse, the one who always found the stricken child and worked to save it. Beverley's defense team told the jury that because she suffered from these severe personality disorders, she didn't know that what she was doing was wrong. On the 23rd of May, the jury began deliberations, which lasted only 5 hours. They delivered a verdict of guilty on all counts. Beverley showed no emotion as the verdict was read. 5 days later at sentencing, the judge imposed 13 life sentences to run concurrently, with a recommended minimum of 40 years. He said, "These were calculated and cold-blooded murders and attempts to murder committed by a young woman who had no pity for the most vulnerable members of our society. You are a serious danger to others and unlikely ever to be safe to release." The judge directed that Beverley be held in a secure psychiatric hospital instead of prison due to her being a serious danger to others. Beverley is still a patient at Rampton Secure Psychiatric Hospital 34 years later, with no release date expected. Patients do pass away unexpectedly in hospital, whether it's from the mistakes of doctors and nurses or from hospital-related complications such as drug reactions or infections. This is called iatrogenic causes or iatrogenesis. There is significant debate over the numbers of deaths annually from iatrogenic causes, but the best estimates indicate up to 26,000 a year in the USA, up to 40,000 a year in Europe, and up to 18,000 a year in Australia. However, there is significant underreporting of this issue by doctors and hospitals because they're motivated to cover up mistakes, to avoid bad publicity, scandal and lawsuits. In Beverley Allitt's case, you would think that after several children in a small hospital suffered sudden rapid deterioration that caused some of them to pass away, it would immediately result in those in charge starting a thorough investigation. But that didn't happen, even in the cases where the children were found with large amounts of air in their heart and lungs, which is impossible without human intervention. In medicine, it's accepted that mistakes happen, and sometimes patients die. Doctors will not take any action against colleagues when this happens, because they want the same consideration when one of their patients passes away. The main motivation of hospitals and health departments is to keep the train on track, as one department head put it. The most they will do willingly is perform an internal investigation. If you suspect that a doctor or a nurse has committed criminal or immoral acts, you should report them to the medical board. In Australia, head to the website of the Australian Health Practitioner Regulation Agency at ahpra.gov.au and click on Concerns about Practitioners. And if you would like to check if a doctor or nurse you are seeing has had previous action taken against them, or if they're currently subject to conditions on their registration, such as drug testing, again, go to ahpra.gov.au and click on Look Up a Practitioner. Thanks for watching. See you next time.